warm welcome to all our Herald TV viewers. Welcome to this episode of Health and Happiness. And to pursue the same very important topic is a very multifaceted medical professional with 25 years of clinical experience. He hails from Calangute and he has got the entire clinic in Calangute where he is well known, and it's my proud privilege to welcome Dr. Lloyd D'Souza.
Thank you very much. It's always a pleasure being here and spreading the message of good health and prevention, always better than cure.
Thank you, Dr. Lloyd. We were talking about the problems that Goans are facing, and Dr. Lloyd will share with us what at one time was thought of, and it's now important to look into diabetes, Goans versus this diabetes, and what we discussed to bring about is making light of diabetes. Everybody gets scared when you talk about diabetes, more scared when they say that if you don't treat it on time, maybe you can even lose your eyesight, you may turn blind, then you can lose a part of your leg, which is happening almost every alternate day in Goa Medical College here. Dr. Lloyd, I think you have chosen the right topic for all of us, and it is a very big problem now in Goa. At one time, nobody thought that it would go to these proportions that we are now watching.
Absolutely. In fact, if I rewind and go back to the day when I just graduated, we're talking about 25 years ago, and we were taught about diabetes being a disease of the West. Something which was so rare, it was hardly one patient in, say, a week that I would see of diabetes. It wasn't so common, and we thought it is somewhere that we are some way immune to that disease. But fast forward 2 decades and the scenario has changed. We are no longer the other side of the disease. We are on, in fact, the side which is being attacked. India and Goa by itself, now diabetes is very prevalent. Almost every 2 to 3 patients coming to your OPD is a diabetic.
Yeah, and when you say about diabetes, normally it would be considered elderly people. You know, you grow old and you have blood pressure, cholesterol problems, and one of them was considered to be also the diabetic problem. But nowadays, I have come across youngsters as young as 25 or 28, and it says, I have been detected with diabetes.
Absolutely. Actually, when you go down a little bit of theory on what diabetes is, so basically there are different types of diabetes. The first one, called type 1, is basically a defect in the insulin production. Now, insulin, just for the layperson to understand, is a hormone secreted by the pancreas. The job is very simple. You take the sugar from your food and pass it on to the cells in our body, which help burn and create energy. If you are not producing insulin, that sugar in the food cannot be converted into energy and accumulates in your blood, causing high blood sugar. And this is called type 1. So type 1 diabetes is a condition where your pancreas is just not producing insulin. And this can happen right from your birth. Sometimes it's detected very late. I had a case about 5 years ago where a young boy, he was 6 years old, who had come to my clinic with viral fever. And by the second day, he started hallucinating. His mother called me desperately asking, I'm feeding him bread and he's asking me, why are you giving me paper? Now, this was an alarming symptom. So is it normal? I said, definitely not. We need to get him IPD, get him into hospital, and we need to run tests. And then we realized the sugars were 500 plus, and that was creating the whole problem. So you can have a type 1 right from birth. So because your pancreas is just not producing insulin. And in that type of diabetes, you need to be on insulin forever or for the rest of your life.
For life. Is it mostly a byproduct of genetics, hereditary?
Yes, it is. Unlike the second, type 2 can be both. In fact, it is kind of governed by your genetics too, as well as your lifestyle. Type 2 diabetes is the condition where you are either not producing enough insulin or your body doesn't know how to use it. You're kind of resistant to that insulin which is produced.
Yes.
That's hence your sugar is not transferred to the cells and your blood sugar goes high again.
Yes.
Usually you get type 2 picked up in the 3rd to 4th decade of our lives. So we usually find patients coming in their late 30s or 40s now with sugar problems, and usually you will have one of the parent, if not both, having diabetes as well. So history does play an important role.
So if you have any one of your parents who have diabetes, you have to take a greater precautions.
Absolutely. It really increases your chances quite a bit. And if both your parents are diabetic, you're almost surely going to be a diabetic if you don't control it and do some major lifestyle changes to prevent or maybe delay it as much as possible.
And the other type of diabetes?
Yeah, so the type 2, which you just mentioned about, is acquired later in life. It's because your insulin is not being utilized properly. There is a third type, which is quite common in medical practice. It's called gestational diabetes. So this basically is something where a lady is pregnant. She is usually non-diabetic, her sugars have been good, but then as she enters mid-trimester, her sugar starts going up, and during her pregnancy, suddenly she's a diabetic. She usually requires treatment during the pregnancy, but once she has delivered the baby, most of them actually turn to be non-diabetic. The sugars come down. They do not need medication, but they are at high risk to kind of develop diabetes later in life. So those who have gestational diabetes need to keep a check on their lifestyle because they can turn diabetic again.
So this is related to the women who are pregnant during the pregnancy.
Yes.
And I'm sure these tests are done normally by the laboratory.
Absolutely. So basically what we do, the common question people usually wonder or ask is, when do I get tested? Now that's a question which most of us would have, because now when you know a child who was 6 years old and had diabetes, you're like worried, when do I get tested, right? How often do we test a kid? So I would say we usually test with certain criteria. Number one, if you are 40, then your 40th birthday post-celebration, you need to start getting a test at least once a year. If it's normal, check it once a year. If it's picked up, we check it as per your doctor's advice. The second thing would be if you develop symptoms. Now, the common symptoms which people have having diabetes would be symptoms like loss of weight. That's very significant. Suddenly you notice in 3 months I have lost 5 kgs. That's not normal. Secondly, you feel constantly like passing urine, frequent urination, the frequent feeling of thirst, picking up recurrent infections, especially groin infections and stuff like that, non-healing wounds, tingling or numb sensations in your palms or your fingers or toes. Well, these are certain symptoms that could be an alarm. It may not be diabetes, but it doesn't cost you much to go and get that test done. As we said, prevention is always better than cure.
Yeah, and there's a lot of controversy now on diabetes type 3. They say that Alzheimer's or whatever it is some plaque formation in the brain. I'm sure you can throw light on this also.
Yes. Now, basically, you need to understand the basic fundamentals. Now, if you are diabetic, like how in CPR, in first aid, we have the A, the B, and the C for airway, breathing, and circulation. In diabetes also, we have an A, a B, and a C. The A for diabetes stands for A1C. That is your HbA1c. That is called your glycosylated hemoglobin. Now, most of us, we go and do a finger prick or a fasting and a PP sugar test after your breakfast or before, and that gives you an idea of what your sugar is for that day. But patients are getting very smart now. They know the doctor's visit is coming up next week. We do a good diet for 1 week and we go and keep the doctor happy. He won't change the medicine, isn't it? But now we have a way to beat that system. So we recommend a test called the HbA1c, and I believe every diabetic has to do the test at least twice in a year. Uncontrolled, maybe 3 times. So what is HbA1c? It's a simple blood test which can be done anywhere at any lab. It's very easy. It tells you your blood sugar of the previous 3 months, unlike your fasting and PP, which tells you about that particular day. So the A of the ABC stands for the A1C. So make sure if you are normal, you do your A1C once a year. But if you are detected as a pre-diabetic or a diabetic, then you do it twice or thrice as per your doctor's advice. So that's the A. The B is basically blood pressure. Blood pressure basically develops as your arteries start narrowing with deposits happening, atherosclerosis happening. The little bit like if you look at a water pipe, if you look at a little hose pipe and you look inside, you'll find the sticky little muck around. And that's what causes narrowing of the passages. If you try to hold your finger on a water gardening pipe, the minute you kind of put your finger forward, you realize the pressure increases. The same thing happens with blood pressure. The more narrow your passage gets, the more your blood pressure is increasing. So hence, you have to make sure, B, blood pressure. Get your blood pressure checked quite frequently as the doctor advises. And C stands for two things. One, cholesterol. The little sticky thing I spoke about is your lipid profile, is your cholesterol deposit. So make sure that your cholesterol is under check. And the other C is your creatinine. Creatinine is basically a kidney function test. It tells you your kidneys are doing well, your diabetes is not harming your kidneys. So the ABC is the basic fundamentals. Get your A1C checked so you know whether you are going to get diabetes, are you pre-diabetic, or you're already controlled or not. B is your blood pressure, and C is your cholesterol and creatinine. I think these three, because the narrower it gets, the blood supply decreases not only to your limbs, to your brain, causing dementia, causing memory loss, causing strokes. There is so much at risk if you don't control the three.
For a common man, I think one need not look into these technical words that we say HbA1c or all that. For a common, ordinary man, blood test will be an indicator.
Yes.
Now, normally people do fasting, then sometimes they do postprandial.
That's right.
But mostly they do not do this HbA1c test. At what age, doctor, should a normal, ordinary person, I mean a very healthy person, start checking for blood sugar?
Yes. Now, sugar is very unique. Diabetes is a very unique disease compared to any other disease. Like say you have heart problems, it affects only your heart. You have a kidney disease, it affects only your kidneys. But diabetes is one kind of disease which affects practically every part of your system. Right from narrowing circulation to your brain, you may be having a stroke. You may have heart disease, obstruction with heart disease. You can have kidney disease, kidney failure. It will affect your eyes, it will affect your nerves. It practically affects every disease. So the first thing to be noted is don't take it too lightly. I had a couple of friends joking over a drink the other day, and they kept fooling about their sugars. And a friend said, my sugar was 270 last week, and the other boy just joked and said, hey, yours is 270, mine was 300, and they were laughing. Well, it's okay for a laughter for that little second, but you got to realize the danger of diabetes is two. Number one, diabetes is multi-organ damaging. It affects every organ, not one. And number two, it is a silent killer. It is not like those heart attacks which are going to cause pain and you're going to run to your doctor saying, doctor, I'm getting a heart attack. You will not know. You will not know. If your sugar is around 200, 250, you may not know. These diseases like eye damages, kidney damage don't happen in a day. It happens over days, months, weeks, even years. So by the time you've actually started the problem, it's a little too late to reverse back. Hence, as you rightly pointed, prevention. We do a test prior. So when do we really test? I normally start with a 40th birthday gift, as I said. Anyone who touches 40 has to get his entire profile done. Because when you have a baseline, it's excellent for the doctors to monitor you in the future. I also recommend getting an ECG done on your 40th birthday, not on, rather after your 40th birthday. Because that way, if there are any changes in the future, we can compare it with a standard that you had prior to falling ill. Otherwise, suddenly you turn up at your 50th birthday with an ECG change and there's paranoia. The doctor doesn't know if this change was an old one or something new, and then you're subjected to so many tests to figure out if this is acute or chronic. So I think 40th birthday would be the latest we could start. Nowadays, diseases are starting much early, so there's no harm in doing a test even as early as 35. But if there's family history, you start early. If you're obesity, if you're overweight, you start early. If you have associated heart disease like blood pressure or something of those kinds, you got to start early. If your cholesterols are high, you got to correlate the whole thing, because these are pillars of your health structure. So you can't just chase one. So if you're diabetic and a cholesterol high patient and a blood pressure patient, the more your pillars are affected, the higher risk you get. So if you have family history or any of the symptoms, if you're obese, you need to get a check at least once a year.
Yeah, and normally they say that it is associated with also excess of sugar intake. And if you look at the lifestyles today, especially youngsters, all your soft drinks, your baked products and all that, which have got a very strong sugar, they talk about this fructose.
Absolutely.
Because when you say fructose, fructose is associated with the liver. It's only the liver that can process it. And they talk also about high fructose corn syrup, which is mostly in all the cakes today. If you go for big parties, big functions, big cakes with big colors on top. And this, they say, are also the causative factor.
It's about living life king size. When I say king size, everything is large now. You go into a soft drink place and you'll have this big jar with a fountain to pour into. You go into a meat shop and you'll have this big steaks out there. You go into certain countries, like that's the reason US is having a big problem with obesity today, because for them everything is unlimited and large.
Sorry to interrupt you. I always say that these are the consequences of the extravaganza of United States.
Well, I guess it's all across the world now.
Now it is spread.
Absolutely. But I remember when I walked into a cafe in the US, you just pay once and then you drink as much as you want. So they'll give you say you ask for a fountain cola, and they'll give you the ice and they'll give you the glass. And then the fountain is not inside the store, it's outside where the guests are seating. So you can just refill, drink it down, refill, it's on the house. So you can have 3 or 4 or 5 refills of that glass. So it's like lots and lots of sugar that you're having, and that's the biggest concern in the US, which is obesity at the moment. So I think if you're really trying to kind of work on your diabetes and your sugar, you need to take a few things into consideration, and that is like a comprehensive thing. We just spoke about the ABCs, which are like the basics in diabetes. But if you look at a condition where, okay, I am a diabetic now, or I've just kind of diagnosed as a pre-diabetic, what do I do? The biggest reason I can associate with diabetes increasing in the recent past is stress. So stress is a part of our lifestyle. You can't even call it something different now. It's there everywhere. It's there in the family. It's there among your business companions. It's among the friends. It's everywhere. So stress is a biggest factor responsible not only for sugar. We're talking about pressure. We're talking about overall health issues which have multiplied over the period of time. So I think the first thing you need to do is find the whistle to that pressure cooker. You need to let that pressure go off. So that can be different for different people. It could be a brisk walk for you. It can be a dancing workshop for him, or it can be a cycling thing, or it can be meditation, it can be yoga, it can be just putting your earpods and listening to some music and meditating. So find that happy spot for you. So that happy spot which you're going to try to do practically every day if possible, maybe for 5 minutes, maybe for 10 minutes, to kind of de-stress your mind and get that stress element out, because that itself has shown significant improvement in all health conditions.
But more and more people today are under stress, and they do not know how to go about and how to get over it.
Absolutely, because the focus of our treatment today is on medicines. We are not really focusing on lifestyle changes. I had a young lady in her late 30s with high sugar about 6 months ago, and she had come, she was already on 4 drug therapy for diabetes, and her sugar, she had the whole chart, the whole year's chart, and it was never below 250. So someone recommended her, and she happened to reach my clinic. So when I looked at it, I told her, with 4 drugs, it only looks like insulin to me, but if you're ready, I can try out something. I push a lot for lifestyle changes. I go to such an extent that I also follow my patients on Strava, the app, which is a fitness app, to make sure they're really doing the workout and they're actually doing what they're saying. So I gave her a chance. She said she would like to do Zumba. I said, fantastic. So we just did basics. We did a Zumba class twice a week. We dropped our carbs in the evening. Okay, we controlled our diet. Medicine remained absolutely the same, and we followed up in about 3 months with an A1C and a sugar, and the sugars were below 200 random, and the A1C was almost normal. So today she's on much better control with minimum medication. So that proves that medicine does help, but medicine with lifestyle changes, I think it's fabulous, and there's a good opportunity for you to bring down your medication too.
Normally they say that all medicines have side effects, and the one tablet that is given for diabetes, metformin or whatever it is, they also say that it has side effects.
Basically every drug in the book of pharmacology has side effects. If you actually go online and you read the side effects of a simple drug, even like paracetamol, it will be frightening, that kind of a thing. So for us as doctors, we have to weigh the two sides, the risks of giving the tablet to the risk of not giving the tablet. So if we weigh that the risk of giving the tablet or the advantage of giving the tablet is more compared to that of not giving it, then I think it's a go. So I think that's a go. But coming back to it, medicine should be the kind of the adjunct, the supplement to it, and not the primary treatment. And if the first treatment in diabetes should be, and I stress it again, we have to give a first attempt at lifestyle changes with stress management. Number two is exercise, which we spoke about in our last episode. We don't need to go to gyms and work out. We're talking about 150 minutes a week.
Now, sorry to interrupt you again. Practically in every village, there are so many gyms you can see, and they display it and say, come here for this, come here for that. Now, even small vados, they have gyms, but there is no correlation with the decrease in the health problems.
Absolutely, because the kind of the attachment or the fixation we have with gym is bulking up, getting muscles, getting fitter. It's not really becoming a healthy version of you. Most of the people, according to a survey, who has joined a gym, the reason for joining is not really controlling your cholesterol or your sugars. It's to get a better body, a better physique, better larger muscles, and a trimmer waist, which indirectly does help, but that's not the focus. So I would say, instead of going to a gym, join a club, join a diabetic club, join a jogging club, join a walking club, join a club which you can just join some and do an activity which is fun. And research has also shown that you continue doing something which you enjoy.
And you have to do it on a daily basis.
Absolutely. Not even daily, Jovito. I think I would think about 150 minutes a week. So 150 is hardly about 2.5 hours. So if you're doing a 30-minute workout, 3 days a week is good enough. So you choose what you like. If you're going to force yourself to be in a gym and work out on something that you don't like, believe me, it won't last long. But if you do, say you like swimming, or you like cycling, or you like running, or you like football, do something which you enjoy, because that will mean you continue doing it. Your experience is very pleasant doing it, so there's very less chances that you will actually stop. Because this exercise benefit is not like you do it for a month and the benefit will be lifelong. It's a continuous process and you need to control. Also, the stress on little bit of muscle building. You don't need to hold a 10 kg or a 15 kg dumbbells. Simple elastic bands, resistant bands, or using your own body weight as exercise is good enough, because the larger muscles, the same exercise you're doing requires more energy, so you're burning more with the same amount of time and exercise.
Yeah. I remember in the olden days of ours, I'm a Catholic, I would go to the church. I would walk to the church. But nowadays, if you go around the temples, churches, you will find so many cars. First of all, there's no parking for that. But everybody says, no, I have to go to the church or a temple, and I also must display that I own a big car.
Absolutely.
Now the problem is, if you were walking in those days, people have not realized that it was a better lifestyle than the present lifestyle, which tells you that I own so many cars, I can all display my wealth.
I can totally correlate this, because if you try to come to Miramar in the mornings at school timings, you know how it is at the Miramar Circle. It's jammed, people staying just in the neighborhood, sometimes coming with cars. It's very encouraging. The school that my daughter goes to, they are encouraging students to come cycling from the neighborhood, those who are there. So they do come in cycling, so that's a very good thing. But exercise, stress management, and the third very important part is the food, the diet, what we spoke about. Usually you'll have a person saying, diabetes, stop this, stop that, stop this, stop that. And again, with research and experience, I've realized anything you tell a patient you're banned for life, he's going to do it behind your back. So I've realized I follow something called the reward system in my clinic. So we have an A1C. Say you have come in with an A1C of 9 for this 3 months. I will tell him, this is the routine, this is the exercise, this is your diet, this is what you're allowed to do. And next 3 months, if you can come to 8 from 9 or 9.5, I can give you 1 day in a month or 2 days in a month, depending on what your value is, where you can go and binge eat what you want. For example, you go to a birthday party, you don't need to announce and say, oh, I'm a diabetic, I cannot eat anything. Go and have a good meal. Because I have realized, at least in my practice, I don't know what the specialist would say about it, but in my clinical practice, I have realized that whenever I have given this reward system, the compliance is much better. They have not tried to cheat. They have not tried to beat the system. And they've actually told me, they've actually come and said, doctor, yes, I had a mango twice in the last 1 month. And they're very open about it. And once they open, the trust begins, and that's when better treatment begins. So I think when it comes to diet, it is about not only what you eat, it's about when you eat. Even about fruits, the big question comes in like diabetes, can I eat fruits? The biggest question, what do I eat? There is something called glycemic index. Now what's glycemic index? It's very simple. It's how much of sugar or how fast the sugar is released into your blood. So if you can eat in moderation small portions of certain fruits like apples and pears, oranges, which will not cause that sudden rush of sugar into your body, they're okay as long as sugars are decently controlled.
Yeah. I think there is so much that we need to learn, and people must understand that it can be controlled. And for controlling, there are measures. I think we can continue it for another topic and then wind it up if possible. But I'm glad that one need not be too much worried if you follow certain norms and rules and you stick by them. I feel that you have thrown a new dimension in facing the diabetics, which is very, very important. Stress is a common factor.
Absolutely.
And as you said, you are involved in dancing. You have been the national champion in one of them.
Yes.
And maybe you can elaborate a little bit on that also when,
Absolutely.
when we meet for the next episode.
Absolutely.
For now, very grateful to you, Dr.
Absolutely.
Lloyd.
The message is stay healthy. Diabetes is not the end. Stay healthy, stay active.
You made it very simple and for the people to understand and not to get worried at all. Thank you very much.
It was a pleasure having me here today. Thank you.